First of all, it's hard. I mean, for us to do this, we had to have a lot of control. You had to have the type of interface program, data lookup program that we had that allowed you to give a lot of control of who sees what. And then on top of that, you have to make some fundamental decisions about how to deal with the information. So for example, we'll use the depression example I gave earlier. Some medicines that are in the category of antidepressants are actually used for other things besides depression. So they're often used for pain control, they're used for diabetic neuropathy, they're used for itching. Okay? They may be used for nausea and vomiting. And so, and normally when you order a drug through an online electronic drug ordering system, it does not ask you what, you don't have to put in why you're prescribing it. So I can say, you know, nortriptyline 75 milligrams, one by mouth daily, okay? It doesn't say if it's for itching, if it's for sleep, or if it's for depression. And it's used for all three of those things. And so if you were going to do this absolutely correctly, you then have to start requiring that at least for drugs in the sensitive categories, you have to require the physicians when they're writing prescriptions to say what they're treating. And currently there's no policy stating they have to do that. And you know, the physicians are having enough problem dealing with electronic health records these days. Adding one more thing they have to do we do that with great trepidation. Okay. The second thing is how do you deal with free text? So if somebody's getting their depression treated in a mental health clinic, okay, then I can, and the patient says, I don't want anybody to see my mental health records. Well then, all you have to do is not show any records from that clinic, whether it's a note, whether it's a drug, whether it's a diagnosis, it doesn't matter, okay? And if that patient goes to a primary care clinic, and the primary care doctor, as one of the diagnoses, writes down depression, you can exclude that diagnosis. When you've got a thing that's discrete like that, like a diagnosis of depression, an antidepressant drug, then you can exclude that information. But what if they put in a note, patients being seen by the psychiatrist for depression? Now, how do you exclude that information? Do you exclude the entire note? So anytime there's mention of depression in a note, you exclude that note? Well, then all the other information in the note that the patient didn't want excluded gets excluded too, with potential adverse effects, because there'd be something in there about you know, an allergy to a medication that might be important that you'll lose if you exclude that note. And even if you excluded all notes that mention depression, what if it says patient has no history of depression? Well, there is no mental health history in that note. And then what do you do if somebody has an allergy to an antidepressant medication or an antipsychotic medication or to you know, something that otherwise would want suppressed? Well, if I say you're allergic to an antipsychotic drug, it means you probably had psychosis in the past. And yet if I don't say that, then potentially life-threatening phenomena can happen if a life-threatening event could happen if you got that drug. So you'd have to make some operational decisions. How do you deal with that information? To exclude information in free text notes, you'd have to use a system called natural language processing, which is computer programs that actually read notes and make sense out of them. So it essentially reads English and makes sense out of them. That's what the Watson program did on Jeopardy, okay? It could read a lot of background information and then in text and make discrete information decisions based on those things. Those programs are very new, very complex, and would be very difficult to adequately suppress all mental health or any other sensitive information within a free text note. So in our system, we took the more straightforward ways, that if somebody said I wanted my reproductive health information excluded, then any note from an OBGYN clinic, any operation that had to do with reproductive health, any mention in a primary care note, any explicit discrete diagnosis from other visits anywhere else could be excluded. But we didn't dig stuff out of notes. It was just too difficult to do that especially in a short period of time that we had. That's something that the technology will have to evolve a little bit to be able to get absolutely firm control.